go.
So, tell me a little bit about yourself here before you came to the office. What's your name?
My name's Thomas Donnelly.
And how long have you been coming to see me now?
Over a year.
When you first came in, what were your symptoms that you had?
Well, I wasn't feeling any pains and stuff, but my main interest was to prevent amputations and not having to use a cane or a walker. And you informed me that my 1 foot, you didn't think you could do anything about it.
Why was that? How much nerve damage did you have in that foot, Tom?
You said like about 80%.
95%.
95%. And
That's the same foot you had your big toe amputated, right?
my small toe.
Small toe amputated.
Yes, I had
Okay.
my small toe amputated there.
And the other foot was, I think, around 85% nerve damage?
Something, yes.
Okay. And so
So
you've
you
been...
didn't think you could help me at all,
Mhm.
but you said if I wanted to try it, you would go along with me to see if it works. And over time, it has worked. My numbers have gone down, where it seems to be getting better. And I also have a foot doctor and a circulation doctor. And both of them agree that my numbers have changed for the better. So for me, it seems to be working pretty good.
What would you say to someone who may be hesitant about doing this program? What would you say to them?
I would say to them, well, it's your feet. If you want to take a chance on having them amputated, then don't do the program. If you want to try it out, it's just a case of getting the equipment and using it diligently and see how you make out.
Okay. Would you think, as far as what your podiatrist has said, what your circulation doctor has said, and they basically have confirmed what's happening to you, that you are improving your condition. Is that correct?
Yes, sir.
And I remember when I first met you, we were in the old program, but now you own the equipment. You do it when you got to. I'm curious, how many times? It's over a year now. How many times a week do you use your equipment?
Twice a day.
You still do it twice a day, every day?
Every day.
Excellent, excellent.
Yes.
And your motivation to do this is why? Why are you doing this?
Well, like I said, I want to avoid any problems with my feet.
But what does that give you? I mean, you go on vacations and this and that, but what is that? Does that give you freedom or confidence to do those things and enjoy them?
Oh, yeah. Oh, yeah.
Okay. So I'm doing this tape, Tom, mostly for people who I guess are, to be honest with you, they're sitting in front of me, and I try to find out what their motivation is to do the program. And sometimes I talk about you. I don't mention your last name or anything. But what would you say to someone that was sitting in front of me and they were going to decide if this was important enough to invest time and to invest finances into their health? What would you say to them as far as that is concerned?
Well, it's almost like anything else. I mean, if they told you a program to prevent cancer, you'd be interested in that.
Sure.
So if you want to keep walking around and avoid losing a limb, it's worth it. To me, it was worth it.
Okay. And I appreciate you, Tom. I know you come here every couple of weeks to get some treatments to stay healthy. I appreciate that you're in a preventative mode and you're proactive about your condition. It gives me great joy to know you and to have you as a patient. I want to thank you for doing this video for people who, want to talk to someone or want to see what people go through in this office. I appreciate that. Thank you and have a great day.
Okay, you all.